Hello and welcome. Have you ever felt like your nose is constantly running, you're always sneezing, and your eyes are itchy and watery? You might be experiencing allergic rhinitis, also known as hay fever. This video will explore everything you need to know about this common condition, from its causes and symptoms to diagnosis, treatment, and prevention. Let's dive in! So, what causes allergic rhinitis? The primary culprit is an allergic reaction to airborne allergens. These allergens are typically harmless substances that, in susceptible individuals, trigger an immune response. Common examples include pollen from trees, grasses and weeds, mold spores, dust mites and their droppings, and animal dander, tiny skin flakes shed by pets like cats and dogs. When these allergens enter the nasal passages, the immune system misidentifies them as threats, setting off a chain of events leading to the unpleasant symptoms of allergic rhinitis. Now, let's understand the pathophysiology, or how allergic rhinitis actually works within the body. When you breathe in an allergen, it encounters specialized immune cells in your nasal lining. These cells present the allergen to other immune cells called B lymphocytes. The B lymphocytes then produce specific antibodies called immunoglobulin E or Ig. These Ig antibodies attach to the surface of mast cells, which are also found in the nasal lining. The next time you encounter the same allergen, it binds to the Ig antibodies already attached to the mast cells. This triggers the mast cells to release a cascade of inflammatory chemicals, including histamine, leukotrienes, and prostaglandins. These chemicals cause vasodilation, which leads to nasal congestion, increased mucus production, resulting in a runny nose and stimulation of nerve endings, causing itching and sneezing. Allergic rhinitis is a very common condition, affecting millions of people worldwide. It can occur at any age, but it often starts in childhood or adolescence. Its prevalence varies depending on geographical location, allergen exposure, and genetic predisposition. For instance, individuals living in areas with high pollen counts during certain seasons are more likely to experience seasonal allergic rhinitis. Similarly, those with a family history of allergies are at increased risk. Studies show that it affects between 10 and 30% of adults and as many as 40% of children. The signs and symptoms of allergic rhinitis can range from mild to severe and can significantly impact daily life. Common symptoms include a runny nose, often with clear, watery discharge, sneezing, frequently in bouts, nasal congestion, which can make it difficult to breathe through the nose, itchy nose, throat, and eyes, watery and red eyes, postnasal drip, where mucus drips down the back of the throat, cough, especially if the postnasal drip is irritating, fatigue, due to disrupted sleep caused by congestion and other symptoms, and sometimes headache or facial pressure. The specific symptoms and their severity can vary from person to person, depending on the allergen and the individual's sensitivity. Diagnosing allergic rhinitis typically involves a combination of medical history, physical examination, and allergy testing. Your doctor will ask about your symptoms, when they occur, and potential triggers. A physical exam may include examining your nasal passages for swelling and clear discharge. Allergy testing helps identify the specific allergens that are causing your symptoms. Skin prick tests are a common method, where small amounts of allergens are pricked into the skin to see if a reaction occurs. Blood tests, called specific Ig antibody tests, can also be used to measure the level of Ig antibodies against specific allergens in your blood. These tests can help your doctor confirm the diagnosis and guide treatment decisions. Allergic rhinitis can be classified based on the timing and frequency of symptoms. Seasonal allergic rhinitis, also known as hay fever, occurs during specific times of the year, usually when pollen counts are high. Perennial allergic rhinitis occurs year-round and is often caused by indoor allergens like dust mites, mold, and pet dander. Some people may experience a combination of both, with seasonal symptoms superimposed on a background of perennial symptoms. Another way to classify it is by severity, mild, moderate, and severe, based on how much the symptoms impact your quality of life, such as sleep, work, or school performance. The goal of treatment is to relieve symptoms and improve quality of life. Management typically involves a combination of strategies, including allergen avoidance, medications, and, in some cases, immunotherapy. Allergen avoidance means reducing your exposure to the allergens that trigger your symptoms. This might involve staying indoors during peak pollen times, using air purifiers with HEPA filters, washing bedding frequently, and minimizing contact with pets. Medications can provide relief from symptoms. Common options include antihistamines, which block the action of histamine, nasal corticosteroids, which reduce inflammation in the nasal passages, decongestants, which help relieve nasal congestion, and leukotriene inhibitors, which block the action of leukotrienes. Immunotherapy, also known as allergy shots or sublingual tablets, involves gradually exposing you to increasing doses of the allergen to desensitize your immune system over time. This can provide long-term relief and may be a good option for people who don't respond well to other treatments. While it's not always possible to completely prevent allergic rhinitis, there are steps you can take to minimize your exposure to allergens and reduce your risk of developing symptoms. Keep windows and doors closed during peak pollen seasons. Use air conditioning and air purifiers with HEPA filters to remove allergens from the air. Wash bedding frequently in hot water to kill dust mites. Vacuum regularly using a vacuum cleaner with a HEPA filter. Bathe pets regularly to reduce dander. Maintain good indoor air quality by controlling humidity levels to prevent mold growth. The prognosis for allergic rhinitis is generally good. While there is no cure, symptoms can be effectively managed with appropriate treatment. Many people find that their symptoms improve over time, especially with allergen avoidance and immunotherapy. Recent research is focusing on developing new and more effective treatments, including targeted therapies that block specific inflammatory pathways. There is also ongoing research into the role of the microbiome in allergic rhinitis and the potential for using probiotics to modulate the immune system. Additionally, advancements in diagnostic techniques are leading to more accurate identification of allergens and personalized treatment plans. With proper management and ongoing research, people with allergic rhinitis can lead full and active lives.